Hi, my name is Emily. I'm going to be the student physical therapist working with you today.
Y yo le voy a traducir. Esta es Emily, yo soy Daniela.
Okay, gracias.
So what brings you in today?
Porque tengo un problema en la mano, esa parte, y en el hombro.
He's saying he has issues making this motion and then has pain along his neck as well.
Okay. Okay. When did this pain begin?
¿Cuándo empezó el dolor?
Hace aproximadamente 2 meses.
About 2 months.
And does anything make it better or worse?
¿Qué le pone peor? ¿Qué le ayuda el dolor?
Cuando hago ejercicio, eso he notado cuando voy al gimnasio, se me aumenta el dolor.
He said when he's doing exercise, it gets worse. The pain's usually there most of the time.
Okay. On a scale of 0 to 10, 10 being the worst pain you've ever had, what would you rate the pain?
De 0 a 10, 0 que no tiene dolor y 10 el dolor. Peor dolor del mundo, ¿cuánto le duele?
Hay momentos en que es 7, 8.
7, 8.
Do you get any numbness or tingling down your arm?
Se siente como si tuviera temblores, como si tuviera cosquillas.
Algún momento sí.
Yes.
And would you say the pain is more dull, achy, a sharp pain?
Que describe el dolor. Es constante, como si estuviera quemando.
No es constante, pero sí es como si estuviera quemando, que lo arranca en mi parte.
It's like a burning sensation.
Y
Yeah, it feels like burning sensation up here, and then he feels it sometimes down in the back of his arm.
Okay. Is there a certain time of day that the pain is worse?
¿Qué parte del día se siente feo?
en la mañana, al levantarme.
In the morning when he wakes up.
Is there anything you are unable to do because of the pain?
¿Qué le previene el dolor?
Cuando estoy en total reposo. Si el día anterior no he tenido actividad física, estoy mejor el día siguiente.
Pero ¿qué actividades no puede hacer por el dolor? ¿Qué le previene hacer?
Todo lo que sea movimiento de los brazos.
So essentially any movement of the arm. Anything that requires moving the arms up, down, moving his arm in general.
What are your hobbies or what do you enjoy doing?
¿Qué le gusta hacer con su tiempo?
Ciclismo.
Like biking.
Okay. And are you right-handed or left-handed?
So usa ¿qué mano?
Both.
Both?
Yes. Ambidextrous.
And do you have any past medical history we should be aware of?
¿Qué problemas de la salud tiene?
Presión alta.
Hypertension.
Bueno, en un momento fue azúcar, pero se ha controlado bastante.
He had issues with the sugar, but it's controlled. You know, he was never diagnosed with diabetes, and then sometimes migraines.
Do you take any medications?
¿Qué medicina?
Losartan.
Losartan or hypertension.
Have you had any imaging done for your arm?
Se ha ido al doctor para que le mire. No.
And does your pain get better when you're in a comfortable position?
Si está en una posición cómoda, le ayuda el dolor.
Boca abajo.
Sometimes, he said, sometimes if he's prone, so he's on his stomach, and he's like lifting his arms so it's supported, it helps.
Okay. Have you recently had any sort of major traumas like a fall or a car accident?
Se ha caído en un carro, en el pie del carro, se ha caído en la cabeza.
Muy pequeño, sí, no últimamente, muchos años atrás.
Oh, he said when he was a baby.
Okay, but nothing within the past 2 months?
No.
No.
Have you noticed any clumsiness while you're walking? Like, have you been tripping or anything?
Ha tenido problemas con balance, coordinación.
La semana pasada un poco, pero tenía la molestia en el oído.
Oh, he said he has an ear thing, and which is sometimes causing
Causing
imbalances,
imbalance.
but he's been to the doctor for
Okay.
that as well.
Do you have a history of osteoporosis that you're aware of?
¿Qué problemas con los huesos? ¿Hay un doctor con los huesos?
And have you noticed any back bruising or any abnormal bruising recently within the past 2 months?
¿Ha tenido morados?
Okay, so that's going to be it for this portion, and we'll move on to the next portion of the exam, okay?
Ahorita lo vamos a examinar, pero si tenemos más preguntas, le vamos a preguntar después.
Okay, so now I'm just going to be looking at your overall posture, okay?
Le va a checar el posture, la postura. Es que se más bien tanto de más.
So just see if you can bring your shoulders back.
Déjalos atrás.
Can you hold it there? Okay. So now I'm just going to look on either side to see if his shoulders are hiking on either side. I also want to check behind here to see if his scaps are ringing at all. Also, when I'm back here, I want to just look at the thoracic spine if I see any humps or bumps here. So that's it for that portion. Okay, so next part of the exam is palpation, which just means, is it okay if I put my hands on you and feel for some muscles and bones on your neck? Okay. So I first want to feel SCM right here to see if it's overfiring, any hypertonicity. And I want to feel bilaterally. Any pain?
En este lado.
That side.
That side?
Yeah.
Okay. So make note of that. Okay. And then we want to feel over here for any SCM. Underneath SCM, we want to feel for the scalenes right here, going down into the first rib and second rib. Any pain here?
Hacia esta parte.
Okay. So pain on the right side. Okay. And now I just want to feel on this side. Pain here? Okay. Now I'm just going to check to feel carotid. Okay. Okay. And now I just want to come around the back. Then the last thing, like levator under here on both sides. I want to feel any pain on either side.
On the right side.
Okay. So last thing I want to do, I'm just going to check the bones. So any pain with my touch? Okay. And then the articular pillars. A little on this side? Okay. So tentative palpation there. Okay, so now I just want to check your range of motion. So if you can bring your chin to your chest. Okay, and I'm just going to apply overpressure here. Pain with that? Here?
Alright.
Okay. Now just lift a little bit and don't let me push your head down. Pain? Okay. Now I want you to come back to neutral. Okay, good. And try and lift your head back as far as you can. Okay, pain?
Yep.
Okay, Julie.
Pain.
Okay. So, come back a little bit. Don't let me push your head back. Pain?
Sí.
Okay. Okay. So now I want you to bring your ear to your shoulder. Okay. And I'm just watching for his shoulder hiking here.
Trata de relajar los hombros.
Now I just want to come back a little bit and then stay
Vale.
right here. And don't let me push your head down, okay?
Sosténgalo.
Pain? And then bring this ear to this shoulder. Okay. Come back a little bit. Don't let me push your head down. Pain with that? A little bit? Okay. Okay, so now I want to come around back. So I just want you to go ahead and look at that wall over there. Okay. And come back a tiny bit. And don't let me push your head. Okay? Pain with any of that?
A little bit.
Okay. Now you can go and look at this wall over here. Don't let me push your head. Pain with that?
No mucho.
A little bit.
Okay. So the last thing I want to do is just do a gross strength screen. I'm just going to assess how strong your neck is, okay?
A mirar la fuerza de los músculos del cuello.
So I'm going to put my fingers
Sosténgalo.
here. Now try and bring your chin to your chest, okay? Okay. And now I want you to go ahead and look at that wall. Okay. Ready? And,
Sosténgalo.
okay. And then this wall over here. Okay. And then you can go ahead and look at the ceiling.
Mire para arriba.
Okay. And I just want you to bring your ear to your shoulder here. Okay. And ear to your shoulder over here. Okay. Okay, so now I'm going to assess the range of motion and strength of the thoracic spine. So if you can go ahead and bend forward a little bit. Okay. And come back and don't let me push you down. Pain with that?
No.
Okay. So now I want you to bend backwards. Okay, got you here. Don't let me push you back. Pain with that? Okay. So now cross your arms over your chest and go to one side. Good. Pain with that? Don't let me push you. Okay. Now the other side. And don't let me push you further. Okay. So now if you can just stand up,
Para que se pare.
and then you're just gonna go reach for your knee. Okay, and don't let me push you. And you same thing. Good. And any pain with that?
No.
No? Okay. Okay, so since you were having numbness and tingling into your arm, I just want to check your neurological system. So I'm just going to use this tiny hammer. I'm just going to touch different parts of your muscle and see if it jumps.
Le va a mirar el sistema nervioso. ¿Cómo tiene problemas con la sensación?
Now I'm just going to test your dermatome. So I'm just going to be touching your arms in different areas, and you're just going to let me know if you feel the same. Okay?
Me va a tocar en diferentes partes. Debe saber si lo siente lo mismo en los dos sitios.
Siénteme así.
Okay.
And then this.
Más aquí.
Okay.
Una sensación.
Okay.
Sí.
So last thing, I just want to check the myotomes. So I'm gonna I go like this with your shoulders. Don't let me push you down. Okay, this. Don't let me push you down. Okay, do this. Good. Go like this. Okay, and like this. This. Okay, thumbs up. Okay, and the last thing I want to assess is a slump test. So I want you to just put your hands behind your back. And I want you to straighten this leg, like this, and point your toes to the ceiling. Okay, I just want you to bring your chin to your chest. Do you feel numbness and tingling?
¿Lo siente? Ahora sube la cabeza.
Okay, now lift your head up. Does it relieve your symptoms?
¿Se siente mejor?
Un poco.
A little bit.
Okay.
Feels it.
Okay, so you can just sit up. Okay, we're gonna check this leg. Extend it, point your toes to the ceiling. Lean forward a little bit. Like your chest. Numbness and tingling?
Ahora.
Feels better.
Feels better?
Mhm.
Okay, and then look up. Feels better?
¿Se siente mejor? It
Okay.
feels better.
Okay, so that's a positive slump test for that. Okay, so now we're just going to perform some special tests just to see what provokes your tingling and pain. Okay,
Le van a hacer para ver qué le ayuda con el dolor, ¿ok?
so the first one I want to perform is the Sperling's test. So I'm just going to apply pressure right here. Let me know if you have any pain, okay?
¿Siente el dolor? Okay.
So I just want to follow up with a distraction test. So I'm just going to lift.
¿Le ayuda?
Sí, ayuda.
Alleviate symptoms.
Mhm.
So then the other two tests I just want to check to rule out anything else is if you can just lay on your back with your head over here. And just relax.
¿Te duele?
No pain?
It feels a little
A
bit,
little pain?
but not.
I'm just going to check the other side. Pain?
A little bit.
Okay. And now I'm just going to check one last thing. No pain?
No.
And no pain? Okay, perfect.
Entonces vamos a mirar cuál es el problema que tiene acá, okay, para ver cómo le podemos aliviar. Okay, so we're just going to be addressing the functional task to make sure this is what's causing the patient issues. Okay. This. Enderezala. Okay. Pain. Okay. Feels pain. There. Relax. I got more motion, but he is having more pain as we go. The patient's having an active limitation as he's going in this direction. Okay, again. So we are going to be doing functional assessment, and the functional test that we chose to do is this, because his biggest complaint is with hammering. Okay, vamos a hacer diferentes movimientos cada vez que le diga hacer así. Okay. Si lo hago así, ¿no? ¿Cuál es mejor? Si hago así, te ayuda. Okay, so that helped. Y quiero que haga como si tuviera algo subiendo. No, como si estuviera el cuerpo. Jala el cuerpo para arriba. Como si tuviera algo jalándolo hacia arriba. ¿Está bien? Así para eso. Relájese. Si estuviera algo jalándolo hacia arriba. Eso. Trate otra vez. ¿Te ayuda? No? Okay, so external stave of the neck helped. Okay, so you're going to be doing thoracic. Okay, thoracic doesn't help. Okay, let's try the scalp.
In my mind, they're like 15, 30 minutes.
Just? Yeah? Okay, so he's saying the neck still helps better. The scalp helped a little bit. Okay, let's just try camp correction. Okay, the neck's still better. Okay. Okay, so the neck still helped more. Okay, and then let's just do a slight compression. Okay, external stave, derecha. No, derecho. There we go. No? Okay, it doesn't help. Okay, and then let's try the rings. Okay, helped a little bit. Next to help better. No, just up a little bit.
This is the chart. Oh, so I can't do that. Do you know I just don't even ask you anymore? I'm like, I'm just gonna.
Problemas moviendo la cabeza. Entonces vamos a ver qué es el problema. So we're just going to be doing a range of motion differential to see what's causing his passive limitation with side bending particularly. Okay, baje este oído acá. Okay, so he's slightly wanting to shoulder hike. Okay, relaje. Relaje. Okay, so you want to bring his shoulder up. Relaja acá. Baje este oído acá. ¿Más fácil? Okay, so that was easier. Relaje acá. Okay, so we're thinking myofascial and neural. Let's see if it's myofascial. Traiga el oído.
No duele.
¿No le duele?
Sí duele.
¿Le duele? Okay. Bring it up. Okay, so that hurt. Okay, puedes correr un poquito para atrás. Póngalo. ¿Le duele?
No, no molesta.
Relaje. Relaje los dedos.
Un poco.
¿Vale? Ok. Traiga los míos al hombro, al otro lado.
No es tanta molestia.
¿No?
No.
Ok. Ahora relájese. Acá. Y vaya atrás.
Mejor.
Better. Okay. Okay. So when we relax neural tension, he's able to get more range of motion. Now, there you go. Okay. Porque como vimos que ayudó con el movimiento del cuello, entonces vamos a ver unos ejercicios para que le ayude a tener el cuello estabilizado. Okay, so we're going to be addressing the cervical stabilization issue that we uncovered earlier, and we're going to do a stabilization breakout. You're just going to do some isometric holds. Entonces, sostengo la cabeza, no me dejo moverla. Sostengo. Corre para acá. Un poquito. Sostengo. Sostengo. Okay. Sostengo. Okay. Alright. Mira, ahora tengo el cuello quieto acá. Necesito que hagas ese movimiento. Así. ¿Qué pasa? Siente acá. Fatiga? Okay. So, patient stating that he's feeling some fatigue around his neck area. Okay.
Okay, I'm just gonna put my hands around your head and then I'm just gonna lightly distract to where it's comfortable for you.
Le voy a poner acá atrás. Le va a jalarle un poquito la cabeza, okay?
Okay, you can drop your head down. There.
Le voy a jalar acá y empujar acá un poquito y después va a hacer la cosa del nervio, ¿ok? No, no, hágalo. Téngalo ahí por 2 segundos. Y otra vez. Mantenga el brazo como la muestra. Derecho. Eso. Derecho, no voltee el brazo. Eso, sí.
Okay, so I'm going to give you an exercise to do. So since you were able to hold your neck in place when she was pushing your head in different directions, we're just going to go ahead and do a dynamic stabilization exercise. So I'm going to give you this band. You're going to hold it like this, and you're just going to move it right over your head, but keep your neck in neutral, meaning don't move it. Keep it still, and do this. And we're going to do this for 10 seconds, 10 times.
Okay. Entonces, este es para ayudarle con este movimiento que vimos que tenía problemas haciendo así, ¿ok? Pero tiene que tener el cuello quieto.
And I'm just making sure that he keeps it in the right spot, looking for any chin pokes.
¿Se siente?
Hay un poco de molestia al lado derecho.
So he's feeling fatigue.
All right, so he's feeling fatigue, which is good. We want to fatigue these muscles.
Okay, so ahorita vamos a mirar si le ayudó con el movimiento que tenía problemas. So vamos a hacer así. Okay, ¿cómo se siente?
Bien,
Okay, patient feels better.
bien.
Okay, ahora baje la mano y voltee la cabeza para ese lado. ¿Se siente mejor?
Mucho mejor.
Okay, so he says there's a lot of relief of tension there as well.